Today we're going to be doing a stretch for the scalene muscles. This is a great everyday kind of stretch for the neck. It's also a great stretch post-surgery. So we're going to be having Rachel here show you what you need to do. Rachel, I'm going to get you to place your left hand underneath your side, underneath your butt there. We want you to lean away from this left shoulder. So this is something you can do anywhere at home, just simply seated or wherever you can find yourself a seat. 30 seconds to a minute is great. We also have some variations of this stretch. I'll get you to come back to neutral here. And the simple variations are twisting in, going down with that ear, coming maybe a bit forward with the head. And then the other one you could do is to go back. So bringing that ear almost behind the shoulder a little bit. Again, 30 seconds to a minute. This is just going to get the different types of scalings at the front or at the back of the neck, but the truest stretch being just directly to the side, ear to shoulder. All right, and that is our scaling stretch. Next, we have a stretch for a muscle called platysma. This is a very fascial stretch, very superficial tissue. This will feel excellent. What you want to do first is place one hand as an anchor on your chest, just underneath the collarbones. You're going to reinforce that with your right hand. Press in. You can almost drag down a little bit. This is going to provide that anchor so you really feel that stretch so that you don't have to tilt back too far, all right? So we'll get Rachel here to lean back, nice and slow. Again, the anchor is the most important part. We don't want you facing straight back, looking straight at the ceiling. We want right about here to feel that stretch. Don't want any dizziness or anything like that going on, all right? So we'll come back to neutral. Some of the great variations for this stretch is twisting a little bit to one side and then going off into that direction. Again, not tilting too far back, just to that right position where you feel that stretch right at the front of the neck. For about a minute is usually best. And that is going to be your platysma stretch. We'll go off in the other direction as well. So working really close to a scar, say a thyroid scar, one right across the neck right here, just above the collarbones. We're looking at working really close to the actual scar itself. A lot of tissue is going to be kind of compressing around that area, maybe limiting your range of motion and whatnot. You want to get your hands nice and close. You want to find resistances, so getting close to that scar, pressing in, pulling this way, pulling that way, going to the other side, even going above, whichever way you can find some resistance, right? So if I go here and I pull straight down and I feel that the tissue really doesn't want to go, I'll hold maybe 30 seconds to a minute, maybe moving my head away from my hands as well, finding that nice bit of tension, and again, holding for 30 seconds to a minute. And again, you can do that all the way across, but specifically finding that down, away, down, closer to center, finding those resistances is really key. Thanks for listening.